Hello and welcome to the Headache Doctor podcast. We're on this podcast. It's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we are going to talk about the gut-brain connection and specifically as it relates to abdominal migraines or even cyclic vomiting. Why do you get GI symptoms when you have a migraine? We're going to talk about the connections between the brain and the gut and between the gut and the brain and why there would be any sort of GI disruption when your head hurts and why would a neck problem have anything to do with that? Now, what I want to do is lay the framework or the groundwork for understanding the mechanics behind a pain signal and the origin of these migraine signals themselves. Before we jump into that, though, I want to share a few just quick patient stories. So I've had a few younger female patients. So when I say younger, I mean like 6, 7 to 9-ish. And generally that is the demographic or the population that we're seeing when we're dealing with abdominal migraines. Now, it can definitely be in adults as well, but it is more prevalent when we're looking at kids. And actually, in the International Classification of Headache Disorders, it's labeled as a pediatric specific diagnosis, and so it's within the pediatric category. So kids tend to present more often than adults with a abdominal migraine. And an abdominal migraine is basically a migraine that presents with midline stomach pain as its primary symptom. Okay. Now, the reason that you'd get to the diagnosis of abdominal migraine when you have stomach pain is that you've ruled out any of the other known causes for stomach pain. So it could be, you rule out IBS, or you rule out Crohn's, or you rule out some sort of food allergy, or just an upset stomach. And so you rule these things out, and then you come to an understanding that, okay, this is just an abdominal migraine. It comes and goes. It'll last for maybe a day or so, or maybe just a few hours. And then you'll have days or weeks or potentially even months with nothing, and then it will hit again, okay? There may be nausea, there may be vomiting, there may be other symptoms associated with it. Maybe it's fatigue, but generally the stomach pain is the worst part of it. Now, we've had a few patients, like I said, younger female patients that present with their primary symptom of abdominal pain, okay? Now, these patients found us because they were given the diagnosis of abdominal migraine, and then they start searching for migraines. They land in our office because we treat migraines. But that is one of the questions in their mind is like, why would we possibly be working on the neck? So there's sort of the scenario I'll lay out, and could possibly even be an adult in this scenario as well. And adults can suffer with GI issues like vomiting, nausea, or cyclic vomiting, things like that, that are going to be applicable or relevant in this conversation as well. Now, when we think about what is actually the underlying issue that's triggering a cascade of events that we're going to talk about, is very often going to be the neck, as we talk about a lot on this podcast. So there has to be something that's initiating this response that the body then takes and has a series of other responses. But the initial response is often the neck. And we know that because we've treated these symptoms successfully. We've treated abdominal migraines successfully. And so by treating it successfully, we're taking our clinical findings, the objective things we find, like restrictions in C1 and C2 and the OA joints, so these upper neck joints that aren't moving the way they should, potentially accompanied with like jaw issues, shoulder issues. And so there's a high level of tension and pain that's starting the upper part of the neck, and it's sending a pain signal to the brain. All right, so the brain gets this signal, and one of the things that's well documented in research when we look at migraines is that serotonin is very involved in this migraine response. And serotonin levels might increase during the prodrome or like right before a migraine, and then they're going to drop during the migraine itself. Okay, so serotonin levels dropping. Now, what's interesting about this gut-brain connection you have a migraine, you have a neck issue, but how would that possibly impact your gut? Serotonin comes into this conversation. Serotonin is produced primarily in the gut. Okay, so 95% of serotonin in our body is actually in our gut. And there's a second type of nervous system, or it's called our second brain in a sense. That's an enteric nervous system. So it's like our gut has its own nervous system in a sense. And serotonin is primarily found in the gut in our bodies. Serotonin is also found in the brain. We've talked about serotonin on this podcast. You've probably taken things like SSRIs or triptans, which impact serotonin levels. So serotonin is something that if you've experienced migraine, if you've been to a provider, if you've tried to understand what is happening with a migraine, you've probably heard about serotonin or read something about serotonin or taken medication to try to adjust or manipulate or reproduce the levels of serotonin. Okay, so the idea with the migraine attack is that serotonin levels drop, and so we're trying to mitigate that or sort of provide a buffer through the medication so that the impact of that migraine is dampened. Now, obviously, that's not our approach here at Novera Headache Center. That's the traditional approach through medication. Now, we know that serotonin levels in the brain impact the body's threshold for pain. So they have an impact on what we feel in the brain, and they stimulate like inflammatory responses and even stimulate things like these peptides, like the CGRP proteins that are sent and transmitting pain signals. And so it all starts to make sense. Okay, like we have medication for the CGRPs, we have medication for serotonin. So we're looking at this cascade of events, and we're trying to stop it, slow it down, mitigate the impact of it. Okay. Now, when we look at the gut, serotonin does have a similar impact in that it impacts the sensitivity level of our gut. And it also impacts what would be known as motility, so like the movement of our GI system, and then also secretions. So when serotonin is released, those things are going to be stimulated, like movement within the gut, and then it's going to impact the sensitivity level of our gut. Okay. Now, they call it the gut-brain axis. Okay. So it's not as if serotonin can like flow from the gut up to the brain or from the brain down to the gut, and like a lack of serotonin in one is like causing this, river to flow through the body. No, serotonin doesn't cross that blood-brain barrier, so it's not as if serotonin in the gut is going to directly impact serotonin levels in the brain, but there is a connection, and that connection is made through hormones. It's also made through the vagus nerve and neurotransmitters. So the vagus nerve is an interesting nerve. It runs through our neck, and the vagus nerve impacts our GI function. It impacts other things, but for the sake of this conversation, we're looking at the vagus nerve as part of the autonomic nervous system. So the vagus nerve can increase our body's response in like fight or flight or rest and digest. And so the vagus nerve is going to be one of these nerves that is important for regulating things like heart rate and then GI function. And obviously, it is connected from our brain to communicate with our gut, but it also goes the other way. So the gut can communicate to the brain. So if the gut's feeling something, or if the gut's dysfunctional, or if the gut has issues, the brain can feel the impact of the gut, and then the brain can impact the gut. Okay, so we see that through the vagus nerve. Now, the vagus nerve also, interestingly enough, we know can be impacted mechanically. So we can stimulate the vagus nerve. There's a few vagus nerve stimulators out there. There's probably more than a few, but there's different types that have electrical currents that you can place on your neck, and it will, in a sense, stimulate the vagus nerve. So once we stimulate the vagus nerve, that should increase like that rest and digest, reduce nausea, put us in more of, take us out of that fight or flight state, calm our body down, make us less sensitive to any GI issues, nausea, things like that. And there's been a few vagus nerve stimulators that have shown to have an impact on migraine symptoms themselves. And that's because of this gut-brain connection and the serotonin levels in the brain impacting what's happening in the gut and vice versa. All right, so we have the vagus nerve. We know that it can mechanically be stimulated. It can also potentially be massaged or physically worked on in order to improve its function. And then we also know that nerves can have a negative impact on them if there's a significant amount of tension around them. So muscles, fascia, tendons, the musculoskeletal system is all intended to move. And if that movement's restricted, then nerves that are running through there will have a lot of neural tension. And so the vagus nerve does have the possibility of having tension around it, which would impact its function. And the reason I say that is because not only is the upper neck an issue in causing a pain signal that causes the that cascade of events of serotonin being reduced, release of inflammation, impacting pain thresholds in the brain itself, but the neck tension can also directly impact the vagus nerve. So when it comes to abdominal migraines, and what we've seen is that we treat these patients just like we would traditional migraine, where we're looking at their neck, we're restoring neck function. We need to reduce the pain signal itself, because that pain signal is what triggers this cascade of events. But then we also need to free up the neck and its potential impact on the vagus nerve. And so what's happening here is the brain's getting a pain signal, and there's this reduction in serotonin levels in the brain, which essentially signals through the vagus nerve to have an impact on the gut's function. Okay, so we see an impact during a migraine on motility, so on the movement of the gut, and potentially even a reduction in serotonin that causes or leads to more of a hypersensitive gut, so a hypersensitive GI system that's sensitive to pain, that's sensitive to foods. And so we've had patients that have stomach pain related to the abdominal migraine, and then when they eat, it gets worse. And then potentially even specific foods, the pain will get worse. But it was more so just eating a meal, eating anything. So basically, their brain was impacting their gut in a way that said, it's not time to digest foods, but then their body was actually eating. And so since their gut was being confused because of that vagus nerve signaling, that it wasn't able to be in a situation where it was ready to digest these foods. It was hypersensitive, and it presented with pain. The other thing that is to note here is we've also found a connection between referral patterns from other spots in the spine. So the thoracolumbar junction is kind of the mid to lower section of the back, can refer pain into the stomach. And so when someone presents with stomach pain and they have tension through their spine, we do tend to look at the mid and lower segments of their back to make sure that there's no referral patterns there. But that is something we've caught in the past. And so we see this, the serotonin levels, where serotonin is mostly found in the gut, we see it impacted by this response of a migraine. And the response in the gut is impacting motility, secretion, and then pain signaling itself. That signaling goes the other way too. So when we think about gut health as it relates to headaches and migraines, there is a direct connection from the gut and its ability through the vagus nerve and neurotransmitters and hormones to impact how the brain's able to respond. And so again, we have the desire or the need when we're looking at someone who has headaches and migraines. We can't look at the gut as a totally separate entity when trying to help this individual. The gut has to be considered as an essential part of this person's health, allowing them to have proper pain thresholds, allowing them to have a proper response to pain itself, and allowing their serotonin levels to be regulated properly. And so gut health is important. And our gut microbiome is made up of all different types of bacteria and fungi. And so we want to feed the healthy fungi, feed the healthy bacteria, feed the healthy microbiome, and that really is through eating whole foods and reducing the amount of processed foods or processed sugars or things that feed the bad stuff. All right, so we have this feedback loop that we've talked about. We have this idea of vagal tone. So the gut will signal the brain via the vagus nerve, increasing the amount of tone. So if the gut is inflamed or imbalanced, it can definitely contribute to migraines. Okay, so the idea here is that if we have poor gut health, it will we'll have altered serotonin within the gut, and then we'll have heightened brain sensitivity, which can lead to more sensitivity to migraine symptoms. At a migraine onset, we have a drop in serotonin, and then we'll have disrupted gut motility and increased GI symptoms or a risk for increased GI pain. Okay. All right. So what do we do about this? Here's some practical strategies that can help you as you're trying to understand, like, why is my gut so involved here and what can I do about it? So like I said, we want to support gut health, eating whole foods, unprocessed, fiber-rich foods as well. So avoid gut irritants. That would be the ultra-processed, high sugars. There's a lot of foods that we assume are fine. And even if you go to Trader Joe's, like Trader Joe's has quite a few processed foods. And we chemically engineer our foods to reduce satiety and increase satisfaction. So basically, we are able to eat more of it, but they're high density calorie foods. And so we have more stress through our gut as our body's trying to process these high calorie foods, but we're eating more of them. Consider probiotics and fermented foods. That's where we get the replacement of the good bacteria in our gut that helps our gut function properly. Increase natural serotonin as well. So we can get just morning sunlight exposure. Wake up, spend at least 10 minutes of the first hour of your day outside, just getting exposed to the sun. Movement and exercise is another way to naturally produce serotonin. So we get a lot of good pain relieving, pain preventing benefits in our body naturally through serotonin, and we can get that through movement and exercise. So it's not just getting stronger, fit, joint improvements. It's actual production of serotonin, which is huge. I mean, that's what most of these migraine medications are trying to do, is like produce serotonin, mimic serotonin, regulate serotonin. And we can do that just by exercising and with movement. So let's take advantage of that. Deep breathing or vagus nerve stimulation practices. So the humming or box breathing, if you're familiar with that, it's humming is humming. Box breathing is inhale 4 seconds, hold your breath. Inhale for 4 seconds, hold your breath for 4 seconds. Exhale for 4 seconds, hold your breath for 4 seconds. It doesn't have to be 4 seconds, but 4 seconds is, I think, the sort of general standard when you're trying to take advantage of it. But if it's 2 to 3, that's okay. But just be intentional with slowing down your breathing, and breathe. And having those breathing practices can be a great way to impact the vagus nerve. Cold exposure, cold shower, the Wim Hof method, or like cold plunge. Those are other really great avenues to go down in order to impact your vagus nerve. Prioritizing sleep is another great way to help stabilize serotonin. Consistent sleep routine. Go to bed at the same time, wake up at the same time, get close to 8 hours of sleep, and eliminate screen time. Like, teach your body, okay, it's nighttime, wake up, expose yourself to the sun, tell your body, okay, this is day. And then whether it's meditation, journal, prayer, something that relaxes your mind, puts your mind in a state of relaxation. All right, so there we go. That's GI dysfunction and how it relates to headaches and migraines. Abdominal migraine, cyclic vomiting, the serotonin levels, the response to this real intense neck pain signal and the cascade of events we see following that impacts our gut. And that's why when you get nauseous, when you're throwing up, when you have abdominal pain, that's what's happening here. It's that gut-brain connection, that gut-brain axis. And it works both ways. It works from gut up and brain down. And so we should pay attention to both. We should get our necks in good shape. We should get our guts in good shape. That's what we're all about here at Novera Headache Center. If you have not reached out to us and you're still searching for relief, please do. We have virtual coaching where we talk you through our processes and what your health can look like. And then we also have in-person care where we get into the physical therapy and hands-on treatment that's been so successful for so many. Thank you all for listening to the Headache Doctor podcast. Where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.